Good morning, ladies and gentlemen, and welcome to the next session of Virtual Course 2024 hosted by Faculty of Pharmacy, Universitas Indonesia. We would also like to remind you to fill in the attendance form as well before we start, as it is required for getting the certificate of participation. For the next lecture, which is Lecture 7, will be delivered by Professor Eiji Matsura from Okayama University, Japan, with a lecture entitled Boron Neutron Capture Therapy, its application for targeted cancer therapy. This lecture will be moderated by Dr. Medi Utami Putri from the Faculty of Pharmacy, Universitas Indonesia. Dr. Medi Utami Putri completed her Bachelor of Pharmacy and Professional Pharmacist degree at the Faculty of Pharmacy, Universitas Indonesia in 2013 and 2014, respectively. She pursued her Master of Science in Medical Sciences and PhD in Biomedical Sciences at the University of Tsukuba, Japan, funded by the MEX Scholarship. Afterward, she worked as a postdoctoral researcher, specializing in molecular cancer biology, focusing on the roles of tempeh in cancer stemness induction. Currently, she is a lecturer and researcher at Faculty of Pharmacy, Universitas Indonesia, in Pharmacology and Toxicology, with research on tumorigenesis and related diseases. Without further ado, I welcome Dr. Medi Utami Putri.
Okay. Thank you, MC, for the very nice introduction. So, good afternoon, everyone. My name is Medi, and I will be your moderator for today's lecture. And sorry, there is a little update. Sorry, Prof. Matsura, for uh, the title of your presentation that have not yet been updated. So, today's lecture will be entitled "The Theranostic in Cancer Medicine," that will be presented by Prof. Eiji Matsura from Okayama University. And before we begin the lecture, please allow me to read Prof. Matsura's CV. So, Prof. Eiji Matsura is a special appointed professor, Professor Emeritus of Okayama University in Japan, and adjunct professor in Faculty of Pharmacy, Universitas Indonesia. He was previously a professor in Research Center for Neutron Cancer Therapy in Okayama Medical Innovation Center in Okayama University. His research interests include lipid metabolism, biochemistry, protein chemistry, immunology, molecular imaging, target medicine, and theranostics. And his research works has been published in numerous journals and textbooks and has been disseminated in many conferences and seminars. So without further ado, let me welcome Prof. Eiji Matsura. The time and screen are yours.
Can the screen clearly?
Yeah, we can see your screen, Prof.
Okay. So, first of all, thank you very much for inviting me to the very interesting Congress. Oh, sorry. Can you hear me? Can you hear me? I'm sorry. I could ask, can you hear me clearly? I cannot hear you. Okay. Today's my topics is boron neutron capture therapy. Its application for target cancer therapy, because your previous title I have already transferred to the slide. So content is completely same. So before the main topics, we do a brief introduction for our institute and biomedical offering so on. And already the Medi kindly introduced me. so I want to skip most of the part. And I work at a United States. After that, I also working sales company because they invited me to organize the new diagnostic division. And after that, I have been back to academic field. In the beginning, I visited to Hokkaido University School of Medicine. Then in 1997, I returned back to Okayama University Medical School. And my major topic interest is autoimmune infection, immunity-mediated atherosclerosis, or molecular imaging, and diagnostics in cardiovascular medicine or oncology, which is my major topics today. So if you are interested, please visit my public score. We have already published more than 200 papers and the textbook, and also attending experience more than 200. Okay, where is Okayama? Okayama is located in the middle west part of Japan, and it is very convenient to access from Tokyo and Osaka. Just in case from Tokyo, it takes about 1.5 hours by flying. Okay, our university have the 10 facility and 8 graduate school and 4 institute and 1 university hospital. So several colleagues from UI and also different university from Indonesia have been visited not only to our laboratory but also our different graduate school. So about 10 years ago, I organized, namely Okayama Medical Innovation Centers. Just now. And Omics. Omics is one of the latest animal molecular imaging center located in Japan that realize medical innovation as a key element. We installed a cyclotron for generating the nuclei like carbon-11, nitride-13, oxygen-15, and so on, to which can be recognized PET imaging system. And also we have the hot laboratory. This was automated nuclear labeling system. And meantime, we also have the good technology for synthesizing and labeled technology for PET probes. And in addition, we can make antibody variant, like a humanized shortening antibodies and labeled with some compound. And always we focus to the cancer and the atherosclerosis, cardiovascular disease, and to develop the drug delivery system and establish the diagnostics. Our system is working under the GMP facility, and occasionally we can do the microdose clinical testing and with pharmacokinetics and pharmacodynamic studies. Not only PET imaging, we already installed several modalities like MRI, ultrasound, CT, and SPECT, and the fluorescence imaging system and bioluminescence imaging system. So at our center, you can do the imaging studies, but we can say multimodal imaging study can be available. Okay, next chapter, what is the cancer and oncogenesis? I briefly introduced. So what is a cancer? It's a disease in which some of the body's cells grow uncontrollably and spread to other part of the body. This abnormal proliferation of the cell may be either benign or malignant. Okay, at the initial stages, some cells originally from the normal cell have the mutation resulted in failure to repair DNA damages. And then due to the cell proliferation, this abnormal cell number is increased. And then another mutation was occurred, and also different types of variant cell with increased growth potentially. Such a mechanism, we expanded variant tumor cell growth more rapidly. If we can say, what is the risk factor of oncogenesis? We have many factors. And first group is, endogenous host factor, like gender. Of course, old age have high risk, and genomics and immune deficiency and lack of the growth factor and inflammation and infection responsible. And the metabolic stage or hormone stage is also very important to oncogenesis. And second group is, this is also like a host factor, but a lifestyle factor. Low physical activity and not good condition energy intake, or alcoholic and smoking and dietary habit, if you like the sweet thing, may also have the risk. And third group is exogenous environmental factor, like we can be exposed carcinogenesis, and also some toxic contaminated in the food. And infection is also one of the risks of the oncogenesis. So if I want to rescue from the patient, cancer patient, it is very difficult to manipulate the particular one risks. Okay, so we have the limitation for diagnosis and the therapy. So next chapter, we talk about the general flow in cancer medicine. Okay, the patient, if we have the this discomfortable pain, everybody, of course, go to the clinic, visit to the clinic, and the clinician check the previous clinical history and do the diagnostic test, and finally they organize to diagnostic review to decide therapy plan. Everything okay, the patient can only do the post-treatment monitoring. But most of the case, unsuccessful, due to the unsuccessful therapy, we have to go around in the circles. So it is very, very complicated between the diagnosis and therapy management. Okay, I also introduce what is the conventional approach of the diagnosis for the cancer. Of course, pathological tests like biopsy, immunohistochemistry, and also a serological test for cancer-specific biomarkers in blood, urine, feces, and some occasionally in the intestinal cancer, we can do endoscopy test. Recently, imaging test is also available, like X-ray, CT, and MRI, and also most recently we can easily get the FDG PET or antibody PET specific for the cancer. Okay, if I can say tell about the conventional approaches of the therapy, okay, we have three major way of the therapy. One is surgical resection to remove the entirely or partly tumors. And also this resection can provide symptom relief, easy pain, and pressure point. And second one is radiation by the X-ray and gamma ray to shrink the tumor and kill remaining cancer cells. And third one is chemotherapy with medicine to shrink and slow or completely destruction of the cancer cells. Usually, most of the case, we can apply for the combination of one of three types of regular conventional therapeutic approach. But we have some disadvantage in each therapeutic way. For example, resection. This is invasive, infectional, and we leave the pain, and it takes a long recovery. And radiation therapy, this is not a pinpoint therapy. So the therapy also make damage to normal cell around the radiated area. In case of chemotherapy, the therapy stunts and kill normal cell surrounded the cancer therapy because we cannot do pinpoint exposure of the because they have also a side effect of the normal cells. Okay, most recently, the recent another novel therapy is available, like a target therapy. We can call also precision medicine. Can be targeting to cancer specifically. And what is that is small molecule drugs and anti-metabolites or immunotherapy with monoclonal antibodies for the cancer. And but before to make arrangement of precision medicine, we require the biopsy to the patient. Gene therapy, this is also now most popular. Therapy genetic material like DNA, RNA, or antisense, oligonucleotide deliver into the cells. For example, P53 or ABCG2 siRNA like these to induce to the apoptosis in the cancer cells. Another therapeutic way is stem cell transplantation, but this technology is only limited in the bone marrow and blood originated cancer cells, and just have the limitation. Today, I will talk neutron capture therapy, namely boron neutron capture therapy, BNCT, is one of the most novel cancer therapy, and I guess very invasive, non-invasive. And photodynamics therapy is now approaching, but still under the development. Okay, from this, I will say, talk about what is theranostics and BNCT. So, theranostics is an innovative concept of medical modality featuring portmanteau of therapeutic and diagnostic system. That was coined in 2002 and has since undergone progressing development into the current clinical stage, but still not completely accepted by clinical studies. And our theranostic system particularly requires or consists of three elements. And we developed already a drug delivery system, DDS device. And also we developed a targeting molecule for the targeting tissues in cancer region. And this provided for molecular imaging, specific molecular imaging, and also specific delivering the therapeutic drug shown in number 3. So this case is function effect. Effector function is B means boron. Boron 10 drugs for BNCT. Okay, I try to also show what is the theranostics by the cartoon. Okay, we prepare this kind of micelle type vesicle. And to form the vesicle, we required biodegradable polymers. And this polymer have to be labeled with radioisotope, like zirconium-89, which can be recognized PET imaging system. And to provide the targeting effect, we also have to prepare and label of single chain FSV. This is the short chain of antibodies specific to the cancer. Should be labeled in this polymer. And inside the area, this is a real hydrophobic core area. So we can also introduce either siRNA space for the apoptosis inducer or B10 clusters. Today, I don't want to talk about the siRNA. I just explain about what is the B10 cluster. And when we incorporated into the vesicle, the B10 clusters. After that, we expose neutron by neutron irradiation can be induced apoptosis in the cancer cells. So this is the summary of the boron neutron capture therapy, BNCT. I would say a novel approach for the non-invasive cancer therapy, which allows to induce the cancer cell death without any harmfulness to adjacent normal tissue. So, we specifically introduce deliver into the cancer area of B10. Okay, this is the cancer cells, and cancer cell incorporated B10 compound. But in this situation, we expose some neutron from the outside body. This B10 decayed into the alpha particle and lithium-7 nuclei. This is very important element. And both particles can be induced apoptosis. So if we try to do the specific BNCT therapy, we have to specifically introduce, okay, to the B10 compound into only cancer cells. Otherwise, surround normal cell also can be targeted by BNCT. Okay. This part show the two compound. We have already applied for the preclinical or clinical approach for BNCT. This is a B10 compound, and the green circle is a B10 atom. Okay, this is basically a structure of phenylalanine. It's one of the amino acids. Okay, amino acid can be attached with one molecule, one atoms of boron. Another compound is namely BSH. This compound has totally 12 B10 atoms. So density is very, very sufficiently great as compared to these. So I just summarize the advantage or disadvantage of these compounds. BPA can effectively against various TAT1 positive cancer cells. What is the TAT1? Is L-amino acid translocase 1. So this is a transporter of the amino acid compound. This is a very benefit to targeted cancer cell because cancer cell increase this receptor numbers. Okay. In contrast, this molecule only containing one B10 atoms per one molecule. As I mentioned, density is much, much less than BSH. So in contrast, BSH had advantage of 12 B10 atom per molecule, high density. But actually, this is a non-specifically approach to the cancer cells. So normal cell also uptake by endocytosis and so on. And this always said by everybody for of the researcher of the BNCT, the ideal boron compound must be non-toxic, of course, and selective uptake in tumor has been provided. And TN, this is a tumor per normal tissue ratio is over than 3. Okay. And high detention in tumor area and cancer cells. In tumor cell, 20 micrograms of B10 per gram in tumor tissue. Or in vitro studies, 10 to the 9th atoms of B10 in one cancer cells. Okay, this is a requirement to be a candidate of the B10 compound for BNCT. So I will briefly explain one by one what is the drug delivery system we established. We have already established polymer, namely lactosome. Lactosome has amphipathic compound features. This part is composed of polychalcocene with hydrophobic moiety, and red area has hydrophobic, namely PLLA, poly-L-lactic acid chain. If this polymer can be dissolved in the chloroform, and once we take the chloroform solution and take dry up the chloroform and desuspended in the aqueous form, this polymer formed such kind of particle like micelles. And inside core area is really hydrophobic due to the PLLA nature. Okay, PLLA polymer is here. So we believe hydrophobic boron, high-dense boron cluster can be introduced inside the core area. So we screening O carboron, M carboron, P carboron, and O carboron acyl chain derivatives, three derivatives. And for example, this is two hydro acyl chain with carbon atom, 6 carbon atoms. Okay, so we call dihexyl, two chain dihexyl C carboron. Okay, and this is a 12 carbon acyl chain and only one methyl. And we focus to those 6 compounds to screen for availability for capsulated in the lactosome particles. And just in the case if we need ICG, this is a near infrared fluorescence, can be also introduced into the particle. This is the fluorescence dye. Okay, I don't want to explain detailed result, but finally we choose the dihexyl O-carbon is best compound to stabilize a particle because O-carbon easily hydrolysis in human bodies like this. But if we have the C6 chain, two C6 chain on the O carbon, this chain is just interacted with PLA helix cores and to keep the stability. This is a diameter of the particle at 4 degrees Celsius, 30 degrees Celsius, or 30 degrees Celsius with fetal bovine serum. This condition is just mimic human blood or human body. Okay, so any condition, once we introduce D6 O-carboran into the lactosome vegetable, stability of the particle is significantly increased. Other compound introduced lactosome is very, very unstable. Okay, so the following several slides show the in vitro and in vivo result, but we focus to the efficacy of the O-carbon or dihexyl carbon encapsulated lactosome. And sometimes we label with ICG. Okay, what is a molecule for targeting to the cancer? Okay, we choose the tumor antigen as a tumor antigen, methylserine protein. And the methylserine is limitedly expressed in normal pericardium and peritoneum. But once oncogenesis has occurred in the normal cells, the density, expression density of significantly increased in the surface of the cancer cells. Okay. We in the previous study, we established the monoclonal antibodies. This is the full length of the monoclonal antibodies to the methylserine, and to see the location of the methylserine expression in the cancer cells. We also screen different types of cancer cell, prostate and mesothelioma, pancreatic, several pancreatic cancer cells. And you can see in a green dot is the location of the methylserine by detecting with specific antibody to methylserine. And then we decided to develop the single chain FV. We collected the human lymphocyte from tonsil and extract the total RNA and prepare synthesize the cDNA and insert the scFv expression vector like this. And after production of the protein, single chain FV was biopanning by the beads coated with recombinant methicillin and cloning and selected by ELISA, flow cytometry, and whatever. And finally, this single chain FV can be transfected into the CHO cells. So we can also express constantly the same quality and large amount. And this is a panel of the several cancer clone studies. Methicillin expression was indicated this time. Plus is methicillin antigen positive, and this column also showed our single chain FV reactivity. So most of the cell expression is very, very consistent with the expression of the reactivity of the single chain FV. But unfortunately, we cannot target with these antibodies to the peripheral blood cancer cells and also neural cells. So most of the carcinoma can be targeted. Okay, by using these antibodies, antibody injected intravenously into the brain to see the location of the PET imaging. You can see these types of antibody accumulated partly in the liver, but also specific to be accumulated in the cancer region. So our concept for the clinical trials, we labeled with nuclei detected by PET to the antibodies. And the antibody injected and circulated into the human bodies, and they can reach to the tumor area, which can be also detected by PET. So the imaging part of the theranostics technology has been already established. Okay, and this is I try to skip because most of the people want to go to lunch. So okay, now we are trying to biodistribution of the lactosome labeled with ICG, near infrared fluorescence style, and injected also intravenously by tail vein. And after injection, we are monitoring the location of the AD lactosome. As shown this slide, between 12 hours and 24 hours from the injection period, the accumulation in the tumor significantly increased. Okay, and this study was also after the 70 hours after the injection, we sacrificed the mice. Okay, and to excite each organ, and this highly colored region was region means the high content of the ICG labeled lactosome. As you can see, two more region containing enriched lactosome and also liver, because such kind of molecular metabolite excreted by through the liver to intestine. So this is very reasonable. Okay, last part. What is the effector function? Okay, this is the in vitro cell uptake studies with B10 cluster and versus conventional B10 BPA. B10 BPA is water soluble, so we just injected directly with pure B10 BPA. But our DDS system is always lactosome particle containing B10 cluster. So we see the cancer cells, okay, together incubated with B10 cluster loaded AB lactosome. And after the incubation, we polyphenized and collected the cell and measured the boron amount by ICP-AES. So this is data as compared with the BPA at the same concentration of boron at 2 millimolar in the culture system. All incubation timing, AB lactosome with O-carburin is very significantly accumulated of the boron number in one cancer cells. And same experiment with has been done with different types of cancer cells. So this time we use 41 cancer cells. This is a mouse cells, and also we try to approach to determine the same way the B number in the cells with CT26. This is murine colorectal carcinoma and the human pancreatic cell SPC1 and the NCN87. This is also human gastric carcinoma. In all cancer cell determined here in the experiment, amount of boron number in the cell is very, very significant as compared to BPA. This is O-carburin encapsulated lactosome. And also after that, we try to see the efficacy of the irradiation, neutron irradiation treatment. Okay. And this is very important data. And without any medicine, and red one is without any treatment of the medicine, but we irradiated, neutron irradiated. So always we have the non-specific radiation therapy effect can observed by the nuclear reactors irradiation. But always we can obtain most significantly inhibitory effect of this case is the colony formation studies is by O-carburin or dihexylcarburin encapsulated lactosome. Okay, then we also moved to the in vivo irradiation studies. Further study is just in vitro. Okay, this is the in vivo studies. before irradiation, 14 days before irradiation, we inoculated the tumor. Tumor growth is significantly in the tail foot. Okay. Then we injected medicine like AB lactosome particle 1 day before irradiation and irradiated, and to see the efficacy of the effect of the medicine. Okay. So this is the result. This case is AB lactosome containing Beton boron or carboran. Okay. KUR is Kyoto University reactor. This is one of the common research collaborative research centers. And we follow up after the irradiation. One marker is changes in body weight, because if we have the toxic effect in medicine, we expected, body weight must be decreased. But in any case, groups, we don't have any changes in body weight. In contrast, this is the y-axis indicated the tumor growth. Okay. So after the injection, gradually the tumor growth is increased as a control groups without any medicine and without any irradiation group. This is a control. And even without medicine, but with irradiation, neutron irradiation significantly decreased. This is, as I mentioned, the effect of the radiation. But, the mice treated with AB lactosome with O-carburan significantly suppress the tumor growth. So this is the first observation was we can use like such kind of theranostics particle with Beton or carboran can be available for the BNCT therapies. Okay. Okay, this is instead of O-carburan, we apply for the Beton dihexyl O-carburan. Okay, also no change in the body weight, but significantly decrease with medicine treatment and irradiation. Okay, this is I think almost a conclusion. So as I mentioned, we can always work with at Kyoto University Research Reactor, namely KUR. So like a big building installed like a nuclear reactor, like a nuclear electric power plant. Okay. And system is by using uranium-235 by at a nuclear reactor may occur nuclear fission. Finally, generated thermal energy and the neutron irradiation can be passed through. And once neutron irradiation to the BPA, BSA can be induced apoptosis in the cancer cells, target cells. But our DDS system incorporated O-carburan or dihexyl O-carburan is much efficient as compared to BPA and BSH. Okay, this is the slide. I would like to again thank you very much, and especially to the executive faculty member of UI and also are my good friends, and Professor Ali Rani and Miss Rani, international officer. And also, we have already invited several students from UI and with another university, like other university like Universitat Udayana and Gajah University and so on. Okay, all younger colleagues achieved very much for developing our researches. Okay, thank you very much for your kind attention.
Thank you very much, Prof. AG, for the wonderful presentation. So now the floor is open for the discussion. So I will welcome all the students here to ask a question to Prof. AG Matsura. So anyone here would like to ask a question to Prof. Matsura?
Everybody has to be hungry.
Yeah, maybe they're too shy. So yeah, while waiting, maybe I have one question, Prof, and maybe
Yes.
sorry if it's a too simple question. So this boron, I'm still curious about this boron, the molecule. So why, what makes it can be specific targeting cancer cells? Can you explain more about that? Why?
You know,
why-
boron compound, all boron compound, like O-carbon, BPA, BSH, has no specificity. But we can make an arrangement of the vesicles, which diameter is about 20 micrometer to 100 micrometers due to the EPR effect. This kind of the vesicle can easily deliver to the cancer area. Okay, so if we labeled single chain FV specific for the cancer on the surface of the vesicle, due to the specificity of the single chain FV, also a vesicle can reach into the tumor area. So we can get the specificity to the tumor by two ways. One is the EPR effect. In this case, we need arrange the little bit big size vesicles. And another way is to use a specific antibody to the cancer.
I see. Yeah. So we need to modify this boron so it can specifically target the cancer cells. Yeah.
Yeah.
Okay. Yeah. Thank you for the answer. So once again, I would like to welcome all students here. Okay. Hello, Tony. How are you?
I'm okay.
Okay. Yeah. Please, if you have question, you can quickly ask to Prof. Matsura.
I would like to appreciate our dear lecturer for the wonderful presentation on the boron neutron cancer therapy. I just have some clarity that which type of cancer are mostly treated with this boron neutron cancer therapy.
For us, we are focused to like this breast cancer and colorectal cancer, and this is a mouse, and also human pancreatic cancer and gastric carcinoma. So I believe most of the cancer cells with expressing of the methylserine can be targeted. But unfortunately, we have only limited studies, experiment with several cancers. And if I can say the specificity of antibodies single chain FV to the methylserine, I already showed the panel. Okay, we have so many cell lines, totally 20 different cell lines from the different sources, liver, pleural, and lung, and lung cell. So any cases, this is a carcinoma. Carcinoma expressed a highly methylserine expression on the cells. So all of the methylserine positive cancer lesion can be targeted by the single chain FV labeled lactosol. Is that enough to your reply?
Yes, I got it.
Thank you.
Okay, another one, maybe the last one. Sorry for over asking question.
Okay.
I know like in our country here in Uganda, we mostly use the chemotherapy in the management of cancer. Now, my question is, how do these boron neutron cancer therapy complements with chemotherapy? Like, if someone is already on chemotherapy, then you bring in the boron neutron cancer therapy. How do they work? Won't they have bad interaction or like some serious side effects?
Yeah, I think I would say cancer therapy has where okay so this is a concept of conventional cancer therapy. As surgical resection, radiotherapy, and chemotherapy. But our BNCT therapy is overcome all of disadvantage of the individual approach of the therapy. So I believe once we establish completely the BNCT system, chemotherapy is completely replaced by BNCT, not combine the chemotherapy and BNCT, because chemotherapy, has many invasive, invasive high risks and high disadvantage. So I really believe we can work to establish the BNCT, which can be improved all scenarios of the cancer approach instead of the all three conventional therapy, including the chemotherapy.
All right. I think I missed that point. I didn't follow that part. In fact, the answer is there. Like the chemotherapy can help shrink the tumor, making it more accessible for the boron neutron cancer therapy to the target cells. Thank you so much for your response.
Thank you very much. So, chemotherapy is, in general, to say, have a very, very severe side effect. So, anybody want to use continuously chemotherapy. So, please hope to our studies development.
Okay. Thank you so much, Tony and Prof. Matsura, for the interesting discussion. So due to the limitation of the time, so I think I need to end this session. So once again, we would like to thank Professor Eiji Matsura. Thank you for giving a very impressive lecture, and I really hope that all of everyone here can get new knowledge and gain a new perspective regarding cancer. So once again, thank you so much, Prof. Eiji Matsura, and I will give back the floor to the MC.
Okay, thank you very much.
Thank you, Dr. Mehdi and our honorable professor. A.G. Matsura for the insightful session. Now, we would like to call upon Professor Padlina Chanisa Putri to present a token of appreciation for our wonderful moderator and honorable speaker. To the documentation committee, the floor is yours.
Yeah. Hello, Masura Sensei. Nice to meet you again.
Hi, nice to
How
meet
are
you
you?
again. Yeah, good.
Yeah,
I'm sorry, very similar talk when I visited you last time.
yeah. Okay, thank you very much for your compelling presentation on boron neutron capture therapy and its application in targeted cancer therapy. Your insightful discussion highlighted the innovative potential of this approach in advancing precision oncology, leaving us inspired and better informed about this transformative field. Thank you once again for sharing your expertise and dedication to such a critical area of research.
Thank you very much for your kind remarks. And we are also working in the theranostic for the cardiovascular disease. So as soon as I try to go to the UI again and to show some topics, new topics for you.
Thank you very much, Sensei.
Okay. Anyway,
Okay.
thank you very much for all attending to pay attention my talk. Okay, everybody have to go to
Okay.
lunch.
Yeah.
All right. Once again, thank you, Dr. Mehdi and our Honorable Professor A.G. Matsura for the insightful session. Before we move on to our next lecture, we'll be having a break time until 13 p.m. GMT plus 7. To all the attendees, you may now turn off your cameras or leave the meeting. Please join back for our 8th lecture at 13 p.m. GMT plus 7. Thank you.
Thank you. Thank you so much, Prof. Matsura.
Yeah.
Thank you, bye.
Bye.
Hope to see you soon in Indonesia maybe, or maybe in Okayama.
Yeah, sure. You can come anytime.
Thank you,
It's,
Prof.
And
it's
also
really,
thanks a lot to
this
your
is a good season, and because they are falling and all changes in the leaf of the tree. And next good time is the cherry blossom in the beginning of the April. You have to consider to come.
Yeah.
Yes.
Yeah.
Okay. We will take it as consideration. Thank you so much, Sensei.
Thank you very much.
Thank
Bye.
you. Please have a good day.